half administrator of the hospital and half practice. Yeah. It's a little hospital, smaller in Medina.
Yeah. The other kids, where are the other kids? That's only two of them.
Well, two doctors, the two oldest ones.
Yeah.
I got a son who works for GE. He's in wind turbines.
Yeah.
And then the other ones are medical. There's a daughter and a son who are physical therapists. And the last son is a clinical psychologist. Yeah.
I think I delivered furniture to your house on Smith Road. Did you have a water fountain installed in the laundry room?
Yes.
I remember that. Delivering furniture. This house has a drinking fountain.
Well,
after 6 kids, it probably made
well, my wife said, I don't want them traveling through the house with their dirty shoes. And it was right. They never used it.
I remember seeing that, though. It was a vivid memory of it. That was the house. And I never saw another house with a drinking fountain.
But in Wisconsin, they call them bubblers.
What's that?
In Wisconsin, they call them bubblers.
Bubblers?
Drinking fountain. I remember when I first went up there in the dorm, the guy that introduced me to things took me into my room and now he said that there's a bubbler in the bathroom, and so I'm thinking, so I went in there. I couldn't find any bubbler.
Suppose in Nairobi, did they purify the water before drinking it anyway, boiling it or anything? I can't imagine drinking it.
They all had little sand filters. The rivers over there are very muddy, and had little sand filters, which would kind of take some of the mud out. But no, there was a lot of waterborne diseases that they had. But then, eventually they got to the point where they'd boil it. I saw a thing, one of the National Geographics, where if you just take a plastic bottle that everybody throws away and put, and over there they were filling them up with river water, set in the sun a day, and it took care of it. Yeah. I don't know how good they were, but probably better than drinking it with.
Rhino poop in it. That's an interesting story. We've got a lot of good stories. I mean, the physicians have all shared, a lot of different things. I can only imagine what somebody 100 years ago would come to the doctor with a broken arm, and like you say, riding in on a motorcycle. I can't imagine riding in on a horse or a buggy would have been much easier.
Well, Lynn Mansell was kind of spanned that. He was kind of the ancient medicine and up to the present day. A lot of us were asked after him to write his memoirs, and he never did. But he had some great stories.
I wish he would have. We had one oral tape that you can't make it out, unfortunately. It was done back in the 70s, and the cassette is just inaudible right now. So we don't have that.
Was that from Lynn Mansell? Yeah.
We're relying on our relaying the story, like you say.
Yeah.
We heard nothing but good about him. Everybody has sung his.
I remember a story he told of a little boy who lived out in Wellington, and he took care of the family. And the little boy came into his office and says, "Dr. Mansell, you got to come home. Mom's really sick." And so he hops in his car, and the little boy hops in, gets into the driveway, and the little boy hops out, and he said, "Mom's okay, Dr. Mansell. Thanks for the ride home." Maybe it was Litchfield, not Wellington.
Boy, R.L. had some stories to tell, didn't he?
Oh, before penicillin.
Yeah, he just sat next to the bed holding their hand while they died.
Yeah, little child had pneumonia.
Yeah,
that was fatal.
Yeah,
yeah, and put mud plaster on their chest and hold the hands. And
that's what I wondered, was amputation, of course, during the Civil War, injuries and so forth. But even after the Civil War, if somebody had an ankle that couldn't be reset, would have been amputated in that
Well, it depends on the how well they could take care of it. Well, a lot of them were amputations, and sometimes if you have a real bad ankle fracture where there's a lot of tissue damage and everything else, putting it all back together, they're going to have probably a stiff ankle and a stiff foot, and sometimes a BK amputation is the best way to go. But that's a judgment call, and we try to save everything. I think they were quick to do amputations back then. Of course, Civil War, if it was an open fracture, it's going to get infected and you're going to die from that. So they had to.
They didn't have much choice.
Yeah.
They're doing ankle replacements now, aren't they? I mean,
Tom Plesiak's having one.
how in the world? Because that's a
compound joint. It's like a.
It's the ankle itself is just up and down, but your foot goes like this.
Yeah.
And the foot joint, but when we were that's a relatively recent total joint. When usually back when I was in practice, before they developed the total ankle, it was a fusion of the ankle.
Yeah.
Where you just make its ankle, but you still had some motion in your forefoot.
Okay.
So it wasn't like it was a big club you were walking on.
So the prosthetic that they use now, it just goes this way, or does it rotate like?
No, well, the ankle itself, most of the rotation is below the joints below the ankle.
Okay.
The ankle itself is primarily up with a little bit of wiggle.
Yeah.
But they were putting them in. People started doing that almost time they were doing total hips and total knees.
Okay.
But they didn't last very long.
Oh.
They didn't have the techniques to make them last. They're much better now than they were then. But total joints have been for hips and knees, has been a remarkable advancement. Total hip is probably the best.
Oh yeah.
Best surgery the best surgery in orthopedics.
I still remember from the first time that he saw me walking the way I walk like this. He said, we could cut the thing and rotate your feet back so they face forward instead of going out like this.
You weren't interested.
Never took up on that.
The amount of times miles you walk, I guess it didn't make a difference.
There's a guy there again now this time. He must be almost 7 feet tall. He's walking over there. I walked up to him the other day and told him that when he died, this was the guy that was talking about functional medicine, actually. It wasn't at the rec center. It was up at Cleveland. He's almost 7 feet tall, and I came and talked to him. I said, when you die, would you leave your legs to me? I said, I got these real short legs, and I love to walk. But if I had your legs, I could really I said, well, that's the first time anybody's ever asked me that.
These have all been really interesting, I think.
What's that?
All of these interviews have been very interesting. What Dave's going to do with his stepson, who's a producer, basically will create some nice YouTube shorts as well as a longer version. And then this room will be transformed into a whole medical history of medicine exhibit next year. So we'll be able to bring it to people who can't get here or up the steps, like at the assisted living facilities and so on.
Yeah.
And education for children. So, we're just trying to kind of show the history of how, and you mentioned a couple key things that most doctors have, what's really changed since you became a doctor. And
yep.
I don't think most people, I wouldn't have known any of this stuff. I've never been a patient, but I think what you and all the others have said about different advancements is really interesting. So it's like I said, it's hard to figure out what they would have done 150 years ago, but you got to believe, like I said, certain things probably were the best they could do. And that's pretty much been the response physicians have given us is that, well, doctors did the best they could, whether it was through morphine or opium or something, live with it, tough it up, but it's just amazing stuff going on now in medicine. You hear about, hip replacements, don't you bat an eye at that. I'm getting my knee or hip replaced. Oh,
It's
You don't think
pretty common.
Yeah, you don't think too
Yeah.
much about it except if you're the patient. I'm sure. But, many of my relatives have had them, and they seem to be, okay, I got this one done. Now I'm going to do this one.
Yep. Well, you wonder what it's going to be like in 50 years.
Well, that's kind of what we're trying to think too. Show this 50 years from now, people are going to think, God,
They were.
Oh my God! Now we just take this pill and the arthritis goes away, or something like that.
Yeah.
Who knows what
100 years from now, that you go into the doctor and they'll say, well, we'll just jack up your skull and replace everything beneath it. So
I said the best thing they could do is put a microchip in all of us that has our total medical history. So when you walk into the ER, doctor's office, they scan it and they say, oh, okay, you had this done.
Yeah.
Your last visit was here, and your weight, your blood pressure, your blood type, everything's in this little microchip that saves all that paperwork you got to fill out in the doctor's office. And
There's a lot of people don't like that idea.
I don't know why. I mean, you can track a FedEx package easier than you can your medical records.
with my chart, you've got almost all that information.
Yes.
It isn't a chip yet, but
Yeah.
you can soon pull it all up.
Yeah, I mean, I pulled it up. I mean, you can see the total history. I mean, it's all there. But I've told the others, but my mom worked for Doc Farnham. People would forget they had their gallbladder, or they would forget surgeries.
Oh, yeah.
And of course, Dr. Farnham wasn't very patient in hearing. He goes, "What do you mean you didn't know?" People forgot. They just simply didn't remember having stuff done.
Yeah.
And he didn't want to be opening somebody up to find out
The gallbladder's already
already gone, or they only have one kidney instead of two. There's, I guess, so I think FaceTime with the doctor is pretty important.
Yeah.
Your total medical history.
Well, they say, you can diagnose with history 80%
Oh, yeah.
of the problems.
Yeah, that's what most of the physicians have said so far.
Yeah.
It's interesting. And my brother's a PA. He says the same thing. He can look somebody in the eye and talk to them for a couple minutes, get a pretty good read on what's going on.
Yeah.
But unfortunately, now it seems like you go into the first thing they do is they order CAT scans and MRIs and all the rest of this stuff without ever talking to them about what the problem is.
Yeah. If you got a bellyache, you go in the emergency room.
That's what you're going to get.
CAT scan.
Yep.
And then the emergency room doctor comes out and says, well, that's just a intestinal flu. Your CAT scan is fine. He doesn't even have to examine them. And I think that's a loss.
Yeah, that's what a lot of them said.
Yeah.
Quick to test instead of quick to talk and find out what's really happening.
They're so focused on technology.
Yeah.
Well, it's been very good. You're welcome to Dr. Castell's coming at 11. 11?
Well, 11.
That was 11.
Yeah.
Is he coming from Johnson Island?
Coming up from Johnson Island.
Oh, I didn't know that. Is he up there with your place?
Yeah, he's same island. He's kind of on the other side of it, but he's
Wow.
full time up there now.
Oh, wow. That's probably why he had to rearrange. I know he didn't rearrange.
No, that was Jeff Case.
Yeah, Case had to rearrange.
He's on. Stage, Jeff. Next
He's Friday.
Friday.
Tomorrow.
Friday, there's one Friday morning.
None of you have Dr. Glennon Jackson's phone number, do you? I just wanted to ask her, invite her to come. I found her address, but there's no phone number on.
Yeah.
I can call the office, I'm sure, if I just leave a message for her to call.
Well, Robertson might.
Denny might know?
Denny might know it. And Roy Miller died.
Yeah.
Denny was one of our first interviewers.
Yeah.
He had some old medical books he's giving us for the exhibit. And Farnham had a microscope somewhere here. Over there. And, so we'll have this cabinet kind of secured with whatever we can kind of tell the story and kind of explain. We've never done an exhibit quite like this. So we're kind of hoping it's unique and people will be interested in coming to see it.
Yeah.
I mean, most people freak out when they see that operating table. They look at that thing and say, I can't imagine being operated on.
Yeah, I don't know if you've got any old stuff around at home that you I've got a bunch of my old eye instruments and things like that. Of course, we used to joke because I'd come in with my little case, all these little tiny instruments, and come in with a Sears Roebuck toolbox. So,
The orthopedic instruments are very much hardware instruments.
Hammer.
And we had remember Debbie Zanoth?
oh yeah, yeah.
She was the
Attorney.
attorney for the hospital. She was very risk averse.
Oh, man.
And we had a little drill that's made by ARO up in Bryan, Ohio. And they make them for the auto industry. And I was looking through, there's a company in Switzerland called Synthes, which sells orthopedic implants and instruments. And I was a friend of mine was he was a mechanic, and he had the instrument book from ARO up in Bryan, and the hand drill, which was a beautiful little instrument, is industrial, and the I was when I was setting up in Medina, I said, well, I'll try to get this stuff, and I see this thing is same thing. So I called ARO about buying one, and they said they were like $120 or something like that. Where the medical ones were about $2,000, and I said, well, he said, well, what are you going to use it for? And I said, well, I'm an orthopedic surgeon. It looks like something that would be, I could use in the operating room. Click. And they have a contract with Synthes in Switzerland for supplying this to them. And if it breaks, you send it to Switzerland, they send it back to Bryan, Ohio to get fixed, and then it comes back to them and they send it back to you. But they weren't about to bypass that.
A friend of mine broke his leg, fell off the ladder, I think it was, and Dr. Rose put a pin in his leg, and he was tapping with a hammer, and my friend's mother passed out just watching.
Yeah.
So I guess that's not that mom and dad.
Well, that's what the instruments. They're a lot different than Lynn's instruments.
Yeah.
Force of 0.12 millimeter teeth. So
0.12 mil.
0.12 millimeter.
I'm just amazed they can make that stuff.
Yeah.
That's so impressive.
You have to operate through magnifying glasses, don't you?
Microscope most of the time.
Is that what
Scope.
doctors are wearing when they have the long?
Yeah.
Microscope.
Interesting. Remember when 10-0 nylon came out? The real fine suture. Well, you probably never used anything like that. 10-0, you can hardly even see it.
Use that for the cataracts and stuff, right?
Yeah.
No, that wouldn't work for us.
You can get fishing line.
Well, is that it?
Yeah, that's it. You're
Thank
great
you.
to have your day back, and
Yeah.
we really appreciate it. We'll let everybody know, have a preview before it obviously goes out to the public, and they'll